Hello and welcome to the next episode of the Healthwatch South Tees podcast. The aim is to share some stories and information from amazing individuals, community organisations and charities that are making a real difference across Teesside and the wider region. My name is Stephen Liggett, one of the many Healthwatch community champions. I'm a stammerer and I work at South Tees Hospital's NHS Foundation Trust as a research project manager. And I am super lucky to host this podcast with the amazing Vicky Jackson, project coordinator at Healthwatch South Tees. You can find out the contact details for Healthwatch towards the end of every episode of the podcast, and contact details for any of the organisations or guests that we have on will be shared at the very end of the podcast or on the platforms that you are listening to this. Thank you so much for listening and enjoy this next episode. Hello and welcome to the next episode of the Healthwatch South Tees podcast. My name is Stephen Liggett, and along with Vicky Jackson, the project coordinator for Healthwatch South Tees, we try and bring you a selection of community champions, organisations and charities that are making a difference in Middlesbrough, Redcar and from across the region. Thanks very much again for joining us, Vicky. How are you today?
Good. Excited to do another podcast. Thank you for having me again, as usual, Stephen. Today we are going to talk to two people who've been involved in a really good project, which I'm going to let them introduce. We've got Kerri Brems from Arch. We've got Dr. Standen.
Yeah.
So I'll let them introduce themselves to you. Kerri, do you want to go first?
Sure. Although I think that was a great introduction. So I'm Kerri Brems. I am a sexual violence counsellor and participation and training coordinator at Arch Teesside, which is a specialist sexual violence service working with any survivor who's experienced any form of sexual violence and abuse at any time in their lives across Teesside.
And I'm Dr. Jen Standen, so I work at the Parkway Medical Centre in Colby Newham. I'm also the clinical lead for the IRIS programme, working with My Sister's Place, supporting domestic abuse victims in GP practices. And I also work for the Greater Middlesbrough Primary Care Network on supporting patients with mental health and social prescribing with Mind.
Super. Should we kick off the podcast with today? It's the Cervical Screening Awareness Week from the 19th to the 24th of June later this month. Can you maybe talk about the journey of the projects that you're working on, maybe, Kerri?
Yeah, sure. Although it feels like it has kind of coincidentally timed very nicely with Cervical Screening Awareness Week. So it feels like this has been kind of the end result of what has been, I think, about a 2-year journey, I would say. Is that right?
Yeah, I think it's been 2 years.
Yeah, so it's really nice to kind of see it kind of all come together. So this project kind of started as a result of, obviously, some of the work I do is working with survivors of sexual violence and trauma, and hearing of their experiences, really, of accessing kind of any kind of gynecological healthcare, appointments for contraception, STI tests and cervical screening. So hearing some of these experiences from survivors, I kind of was starting to look at, okay, well, what is in place for survivors of sexual violence to access these appointments, any kind of, things that could be implemented, and looking across locally and nationally for any kind of guidance. And what was coming up was very much a lot of ownership, really, on survivors to have to share their story and share what they'd been subjected to in order to get better support or access to other areas of support. So that didn't really quite sit right with me, kind of thinking, okay, well, actually, why should survivors then have to share what they've been subjected to if that isn't something that they want to do either? So I kind of reached out to Vicky at Healthwatch. Obviously, I am a community champion as well. Kind of said, okay, what can we do? And Vicky, obviously having her ways and contacts, pulled together a really great steering group with Jen, Angela, who is the Integrated Care Board, I think, for the NHS Cancer Lead. I'm sure I've said her title very wrongly, but she's amazing. And contacts from South Tees Public Health as well. And we kind of came together to look at, okay, what is there locally? What can we do? And also looking at kind of statistically as well, you know, in Teesside, we have probably got one of the lowest uptake of cervical screening in the area. And I just thought kind of teaming that with the higher rates of sexual violence, trauma, domestic violence that we've also got in the area, is there a link there? Is there something that us as an area can maybe look at? And that's kind of where it started, really.
Yeah. I was trying to look up some of the stats, and obviously there's quite a lot of people are accessing GPs and healthcare services in almost in an attempt to disclose or tell the story, like you're saying. It shouldn't have to be that way for them to get cervical screenings or access to any kind of sexual health services. What was the findings of this project? What can be implemented to maybe speed up that referrals or people just feeling comfortable to access these services?
Yeah. So I think what you described there is almost like a two-pronged approach. So people will, you know, for anyone who's experiencing any kind of psychological distress, will go to their GP to look at, okay, what services out there. But then if you put that alongside kind of people's physical health needs as well, and appointments, like you say, screenings, you know, from the age of 25, you know, women start their screening for lots of different things, and it doesn't end until we're much older. What came of this particular project was hearing from survivors. So the steering group, you know, we pulled together some questions to put out, and it was answered, I think, by about 47 people who had experienced any form of trauma. And some of the findings from that was really quite prominent, really. So a lot of people commented on the fact that they had experienced trauma, and they just found even getting that letter through the door really quite triggering. You know, they knew automatically what that was, and they ignored it and they put it in the bin, because for them, even just the thought of going for a cervical screening, for a smear test, was causing a lot of anxiety, a lot of fear, a lot of dread. Not only that, for the people that maybe had attended a cervical screening appointment, their experience had been really quite negative and quite traumatic, which then put them off accessing again. So it's kind of looking at, okay, well, what is working, what areas of good practice were great, and some of those areas were really quite lovely to read. So people were talking about how caring and nurturing and patient that the person performing the appointment was, and going at people's own pace, and that really made a difference. So the attitude of the nurses, the attitude of the GP, you know, being provided all that information in advance and given that information, which, you know, doesn't always happen. And I think we recognised that there was lots of different gaps across the area. You know, people are trained differently, and as well as survivors are very different as well. So, you know, you could see 5 survivors of sexual violence in a day, and all of them would need different things, because trauma is individual to people as well. So what came of that is, after the survey, we kind of pulled together some of those findings, and we also asked what would help survivors, you know, what would be great for them. You know, and some of those options were, would it help if that experience of sexual violence was already on file? Would it help if, you know, you had a telephone call beforehand, or, you know, just some information that would help, so it took that ownership again off survivors? And one of the other options that we came up with was a little information card, really. So a bit kind of like the sunflower lanyards for anyone who's got any additional needs. A way to kind of highlight, I need extra help, but I don't want to have to say that. So the cards kind of came as a result of that, and we then pulled together a focus group of survivors to look at, well, what would a card look like? You know, what colours, what images, what information, what statements, how big do we want it, how little do we want it? And the survivors created just a little kind of wallet-sized card, very simple, and it just kind of explains, you know, because of past experiences, I need some extra support. And it's kind of a really nice way of just being able to say, I need help, I need support, but I don't want to have to share why I need that, but Absolutely. This is what I need.
And you described it there as simple, but often the best solutions are, you know, just something visual that can be shared easily, can be accessed easily. Exactly. And we should say that we'll link more information to this on the podcast, and obviously you've been on a previous podcast as well, Kerri, so we'll link that to this one as well, so there'll be plenty of information for people to access.
As Kerri explained, we sort of brought together a group of people, and I think we really tried as well, didn't we, to include people from all different backgrounds, because we felt it was really important, obviously within our community champion network. So we spoke to somebody who has experienced and works with people from the trans community. We looked at cultural difference as well, because I think that we needed to make sure that all of the questions, even in that initial stage when we were asking people to share their experiences, we needed to be really aware of the words we use to be inclusive on everything. So I think we really tried to make sure that we were considerate, and we will continue to kind of do that as it rolls out, really.
Jenna, so what was your kind of experiences of the project?
Yeah, so I think it's been really good to work on, and I'm really kind of pleased with the cards that we've come up with, because I think from the GP side we do have some patients who don't attend for smears, and it's exploring that in much more detail. And I think the letters they receive are very standard, but actually everybody's experiences are difficult, and for some people even setting foot in front of the practice is difficult. For some people being in a room with a bed is difficult. So it's tailoring those experiences. And there's lots of things that we can do within the practice. For some patients, it might be that they might want to meet the nurse and just have a chat before they actually book a smear, so find out a bit more about it, and then they maybe need a bit more time to process it before they book it. It may be that they want to say, well, I'm going to have a smear, what do you use, what does the brush we use, what does it look like, and then they want to have a bit of time to process that, and it may be that is enough to kind of support them to take the next step. It may be that they need a bit more time, but I think as well, it's as you've said, it's important that patients don't feel pressured into explaining why they find it difficult. And I think we are there to support people, and if they're wanting help with the experiences they've had, we're there to listen, we're there to signpost them to the right support or to provide support. But it's being able to sort of access that test and just say, I find it difficult, I don't really want to talk about it, but we need to do things differently.
Do you think this could be rolled out to maybe different communities? Could it be used for, disabled communities, anyone that has visual needs, problems with hearing? Could you see this project having legs and going elsewhere?
Oh, definitely. I think, we focus predominantly on cervical screening, and that was because of, it came from a female survivor. So it was about looking at gynecological healthcare. And we know, especially for women, and women who experience psychological distress or trauma, have extra barriers to accessing any kind of healthcare appointments anyway. And as women, we're massively kind of not heard in kind of health settings a lot of the time. So I think for us it was focusing particularly on that group, but actually the beauty of the cards is that they can be generic. For example, I would love to see male survivors use these for if they needed to go for prostate exams, which ultimately will be very difficult for some male survivors of sexual abuse and trauma as well. But actually, because they aren't specific, so they don't say cervical screening specific, they can be rolled out to any kind of screening, so bowel screening, breast screening, they can be adapted. They are simple as well, so they are easy read, they are exactly what they are. We haven't overcomplicated it because we want to make them as accessible and as easy to access as possible.
And I think it's important that they're available in different formats as well, isn't it? So you don't just have to have a printed card, you can have something that's downloaded on your phone, and didn't particularly want to have something in your purse or your wallet or whatever, you can have something kind of on your phone that only you know's there as well. So I think that's really good as well, that people can choose the way that they want to have it kept, and also the way that the message is shared, and you can sort of like with your practice, you can access people and just send them a link and say, this is, nobody necessarily needs to know or ask for it, do they? They can just get it quite quickly and easily.
I think as well, a special mention, it kind of self-tease public health as well. They're currently working on their new campaign, which I imagine, you'll see more about kind of closer to Cervical Screening Awareness Week. But they've offered to print the cards as well. They're adapting their leaflets and merchandise, and have really kind of worked with us as well as a service to get that messaging right as well for survivors, and make sure that it all comes together. So you've got the leaflets, you've got the website, you've got the tips, you've got the signposts, and you've got these cards. So trying to make it as easy as possible for people to go for screenings.
And we've been talking about speaking to an organisation that works with people who maybe don't use English as the first language, or people who are visually impaired, people who use BSL, and how we can sort of spread the message and how it works for people from those communities as well. So that's something that we have always considered it, but we're going to pick up how we can share that way as well. And I think that it would be really, we were just speaking sort of before we started the podcast, and I was asking Jen what would happen if somebody came in, and I think it would be good to sort of explain really what does happen if English isn't your first language, or you need an interpreter for BSL.
Yeah, so again, if the practice is aware of that, we would arrange for interpreters. We can ask for, if you're wanting a female interpreter, for example, we can request that. The other thing is, if you are, for example, having a smear and you're not wanting that person to be in the curtain with you, they can be outside of the curtain, or they can even leave the room at a point if that's what you want. So we can work around, or even facing them the opposite way, so they're looking just at your head while you're having the smear as well. So there are kind of ways around it.
Yeah, I think that's really important, isn't it, to get the message across about how you can still have that somebody there to explain things to you in a way that you understand, because you might just not go because you think, I'm either not going to understand, or have somebody else in the room, which I don't want. So I think that that's really important that people understand that.
We can as well, I was going to say, we can do some interpretation if it's over the phone and it's virtual as well, and there wouldn't be somebody in the room, and you could do it with the phone on speakerphone if that was more comfortable for someone as well.
Yeah.
I think that was one of the things that came from the survey, was just that sometimes feeling like that pressure of going to the appointment, but having all these anxieties, all these questions, all these fears, and then people are sat there with those fears and anxieties and questions, and not knowing, well, what can I do about that? Like, where do I go with that information? And then it creates more anxieties than 3 years down the line, or when you get another letter, it's bigger. And what we're trying to do is trying to ease that anxiety, whichever way that people are accessing their appointments, just making it a little bit easier. We know that if we talk about it and make those conversations easier to have those conversations, it reduces people's anxieties. We know that. So yeah,
I think it's doing it sometimes in steps, and it may be a case of just like, okay, I don't feel ready to have a smear, but I'm going to just go and find out a bit more about it, or I'm going to speak to the nurse about it, and that might be that's a really positive step forwards.
I think as well as for women, we tend to put ourselves last on the list as well. So I think this is us kind of saying, actually, women's appointments especially are really important, that they are, that you deserve to have your appointments, and I think as women, we're very guilty, especially if you've got caring responsibilities or work. It's like, I'll deal with that later. And then later is often 3, 4, 5, 6 years, and people are saying, actually, I don't remember the last time I had my letter for my screening. So again, I think it's prioritising, isn't it? It's trying to make it just accessible.
Before the podcast, I went to speak to some of my female colleagues. Did they have any questions with it being Cervical Screening Awareness Week soon? And they want to know if you had any kind of top tips for going to the appointment and what to expect when you're there. Maybe that might be something that could be raised more. Maybe do we speak about it enough? I mean, I certainly wouldn't go into a men's appointment. It's very much not discussed, and it's maybe the same for women, I'm not sure. But
I guess I mean, I'm not an expert in cervical screening.
No.
I've got like my own personal experience.
Exactly.
So, you know, I don't mind sharing that. I go like yearly now for appointments. So I feel like, you know, 10 years down the line, I'm well equipped with preparing for appointments. But I suppose my experiences came from the women that I support, you know, and the survivors and what they say that they would want. And some of the tips is about, you know, for them, it's being able to have all that information, you know, especially when we've experienced trauma, sometimes you struggle with that information and you know, our worldview, it will catastrophize things because our brain is primed for trauma then, so we will already think about the worst case scenario. So it's trying to have all that information and even stuff like visuals, like what Jen was saying, and what does the room look like, how's it set up, what's the tools, you know. We know that helps people, you know, making sure that people know that you can bring someone with you if you want, you can stop, you can ask questions, you can pause. Like, one of the best experiences I've had was with my dentist, which I know sounds like a really strange thing to say, but I was really anxious going for my dentist appointment, and bless the nurse, she was like, just, you can stop me at any time. And I was like, can I? Like what? Like, she was like, just put your hand up. And I was like,
you're in control almost.
That is exactly it. Is for survivors, like, it's important that they know that they are in control of that appointment at all aspects, you know, because it is invasive. And I think, you know, it's worth remembering that for some people who've experienced childhood sexual abuse or trauma as a young adult, you know, they might have gone to the sexual assault referral centre and been examined and had all forensics, and then their next experience of that is a cervical screening. And how does that translate for people? How do people feel about that? Because for a lot of people, this is just everyday stuff, but for trauma survivors, it isn't. I always say to people, you know, try and do something for yourself after appointments, you know. So, you know, go and get yourself like a nice like coffee or chocolate bar or something that really kind of indulges your senses. You know, one of the things that came out of the survey was, you know, I would love to be able to take fidgets and my own blankets, and, you know, very much, again, sensory needs as well for anyone who is neurodiverse. So it's thinking about all those things, like just, you know, come as you are, I guess, you know.
I would agree, and I think it's booking the appointment, because it might be that you prefer to book like a morning appointment, because if you have it in the afternoon, you're worried all morning and you want to get it out of the way, or it might be the other way around, that you're more anxious in the morning and you want it in the afternoon. It's like Kerri said, it's bringing someone with you if you want, whoever that person may be. It might be that you want to wear like a big hoodie or something, because that's your kind of comfort and you want to sort of wear that. A lot of women do choose to come in skirts. Again, it's personal preference, but just because then you're not having to remove as many clothes, you can just lift the skirt up and lift it down, so you're not having to get undressed in the same way. If there's other things that help you, like having relaxing music, you can put that on the phone. Just ask the nurse who's doing it. So there are sort of adaptations that we can make to try and make the experience better for the person that's having that.
That is great, and I think, patients do have choice, and they should be more in control. And maybe as the NHS, and I obviously can't speak for the whole organisation, but we're maybe not that good at putting patients in charge of things. Maybe, like, you know, it's there's probably still a complex around the doctor is in charge, the nurse is in charge, the clinics that we have can be quite impersonable and you know, look very white. It looks very clinical. Maybe we can start to change how we kind of set these things up. Full time, maybe.
Definitely. I think as well, it's about power, I guess, as well. Like, for, you know, for a lot of people who've experienced sexual violence, you know, they've had power taken away from them. You know, so again, asking them to come to the appointment, the power imbalance is already, you know, they've been invited to this appointment, but it's not really an invite, is it? Because it's, you know, you have to go to this appointment for your health, for your well-being. And I suppose it's switching that narrative of, actually, I'm important. This is my appointment. This is my health, and this is what I need in order to look after myself. Like, you know, I think that's what's needed.
I think as well, an understanding, am I right, Jen, that the letters that go out have certain text in, so it's not something that it's not as easy as just sort of changing the standard letter that goes out to everybody. It has to have some kind of standard text in, and I think that's really difficult, isn't it? Because you are just going to bin that letter if that comes, you don't open it or whatever, because you know it's going to say the exact same thing that's been said before.
Yeah, and I think there's very much with the letters, because they don't come from, so it's not that we're sending them from the practice.
No.
We might know that somebody's had a really traumatic background, but we're not sending those letters. So they are very, very sort of standard. And I think that's quite difficult. And I think sometimes there's that pressure as well, because the focus, obviously, we want people to get that cervical screening because it is important, because we can pick up early changes, because we can prevent cancer. But that in itself sometimes increases that pressure on that survivor, that they need to go, or they're worried what will happen, but then they're struggling to go because of what they've kind of experienced. So it's like they feel under that pressure, as well as dealing with the anxiety around the procedure and what might happen.
I think it's really important that survivors have control of their own bodies as well.
Absolutely. I think sometimes if somebody's coming for a smear and it is a little bit more difficult for them, or things are a little bit drier down there, again, sometimes we'll give them sort of treatments down there to make it more comfortable and bring them back at a later stage when they've had some creams and some treatments.
So just before we end, it's been a fantastic discussion. Thank you so much for your time, everyone. If anyone is listening to this podcast and needs access to one of these new cards or any extra information, where can they get that from, Kerri?
Hopefully, like I say, they'll be on our website. South Tees Public Health have got a campaign launching for cervical screening Awareness Week. So the cards will be available on the South Tees website. We're distributing them to our survivors and across the South Tees kind of network. There's a lot of great work happening outreach as well. So again, health appointments going to women. So I know there's a few locations across the area where people can access cervical screening without having to go to the GP practices and stuff. So we're making sure that they have copies of them as well. And
I think that's absolutely brilliant.
They are going to be available at GP practices. Healthwatch are going to distribute them. Cervical screening appointments are available at different kind of women's centres and outreach provision across the area as well, so we'll be making sure that they're available. Yeah, and if anyone does have any questions, they can just contact me directly. That's absolutely okay as well.
Yeah, we'll share your contact details at the end of this podcast. That's all right.
Yeah. Our website is Healthwatch Middlesbrough or Healthwatch Redcar in Cleveland, or anybody could give us a call on 0800 118 1691. Can text only to 0745 1288 789, or email us healthwatchsouthtees@pcp.uk.net.
Cheers, Vicky.
Thank you.
Cheers, everyone.
Thank you very much.
Thank you so much to Kerri, Jen and Vicky for being so open and for sharing so much fantastic information about a really important subject. I personally learnt so much from that discussion, and I hope you did too. As promised, those contact details for Arch. You can call Arch on 01642 822 335 or use their website archteesside.org, where you'll find details of how to contact Kerri directly and also links to the cards that were discussed. There is also a really great NHS website, cervicalscreeningawarenessweek.com, with tons more content and information and a really good question and answer section. We also have Jen returning to this podcast soon to continue the conversation around her GP work and her involvement in the IRIS project, which will be another fantastic podcast, so catch that when it comes out. Until then, thank you so much for listening and take care.